Hi guys, Dr. Rachel Winstead here. I'm recording this video not to give you medical advice or legal advice, but because I was on social media yesterday and I saw a video posted by Dylan White. You may know him better as that guy who has really cool, funny stories or little vignettes about his life while sitting in the car, drinking a cup of coffee, and he's always got a great pair of glasses on. He and his wife are really funny. I don't know them personally, but their social media content makes me think they're just really wonderful humans. Well, Dylan White is also an attorney who's representing a group of women who are suing Pfizer. They're suing Pfizer because they claim Pfizer knew that a medication, Depo Provera, that they make causes brain tumors, and they failed to disclose that to consumers. I think I saw it on social media on my feed was because recently, as in the end of 2025, the FDA approved Pfizer's request to update the black box warning. Black box warning is literally a warning of the worst possible outcome of taking this medication, side effects, that has a black box around it. It is on the medication insert, it's on the packaging. And with Pfizer, the updated black box warning is if you take this medicine, you're at an increased risk for developing a meningioma brain tumor. So let's talk about what Depo Provera is. Depo Provera is a progestin. More specifically, it's depo-methoxyprogesterone acetate. It is a synthetic form of progesterone, a hormone that we make. It's a pregnancy hormone. It helps women get pregnant and stay pregnant. And the way this medication works is you do one injection every 3 months, and it helps prevent you from getting pregnant because your body is already thinking it is pregnant. You can't get pregnant if you're already pregnant. And the challenge is these meningiomas have receptors available for hormones, and in particular, the progesterone or the progestin in this case. And that's why it's causing or triggering some people to create tumors. The good news is the meningiomas are not malignant, meaning they are not going to spread throughout your body, causing cancer everywhere. And the other good news is that they're very slow growing. Unfortunately, they do still cause symptoms, and those symptoms need to be identified. You need to correctly identify that there is a brain tumor and have the appropriate therapy to get rid of that. So that is why I think we're seeing it right now, and it probably will continue to pop up more and more over the next few months and years. So what even is a meningioma? Well, a meningioma is a type of tumor that grows in a structure called the meninges. The meninges is this protective cover that's around but not in or part of the brain and spinal cord. It sits deep inside the skull and the spinal cord, but not quite as deep as the brain and spinal cord. Its job is to protect our central nervous system. And when a tumor grows there, it actually causes a lot of pressure and damage to the structures inside of it. A brain tumor can occur anywhere in the meninges. Symptoms of a meningioma vary greatly based on the location of the tumor. The tumor grows slowly, but as it grows, it does damage important tissue. And that damaged tissue is what dictates the symptom. It is important to identify a brain tumor and treat it. And there are highly effective treatments for this non-malignant type of cancer. It is slow growing, and it is in fact the third most common type of tumor, brain tumor. So just because you've taken Depo Provera, that's not a guarantee that you're going to get a brain tumor. I want to go through and explain a little bit more about the risk and what all the studies show and why Pfizer had to put that black box warning update on Depo Provera. So this study here is a study that happened recently in the US, and what it showed was that women who took Depo Provera were about 2.5 times more likely to be diagnosed with a meningioma. There's some other nuances and caveats here. What we're seeing is women who took this medication for 4 years or more were at a higher risk, and women who started this medication after the age of 30. Those factors increase the chances of being diagnosed with a meningioma. This is another great high-quality study. This study is out of France, and it was done just before the US study was released. It looked at all the women who had meningioma brain tumors, and then it looked at their medications. And it found that women with meningiomas were about 5.5 times more likely to have been exposed to Depo Provera or to have taken Depo Provera. I do want to emphasize that Depo Provera is a very safe medication for most women, and that the occurrence of meningioma brain tumors is quite low. To do that, I'm going to share with you 2 visual representations. This first representation is showing you 1,000 women. Each of these figurine circles, they represent a woman. This is women who have not ever taken Depo Provera. The chances of developing a meningioma are somewhere between 0 and 1, so it's very, very low. In this visual representation, what you're seeing here is, again, the 1,000 women. So each of these characters, each of these circles, dots, they're a woman. And for women who took Depo Provera, somewhere between 1 and 2 will develop a meningioma brain tumor. Slightly higher than someone who has not had exposure to Depo Provera, but still very, very low. I'm showing this visual so that you can feel comforted with the fact that it is a very, very rare condition. And again, it's also very slow growing, so we have time to diagnose it and get appropriate treatment. There are a great number of symptoms and signs that you might be noticing of a meningioma. The reason they vary so greatly is because the tumor's location and the type of brain tissue that is damaged dictates the symptoms that you experience. These are the symptoms here: dizziness, headache, hearing loss, memory problems, muscle weakness or paralysis, nausea or vomiting, personality changes, seizures, vision changes such as blurry vision or loss of vision. And they're just varied. You do not have to have every single one of these, but these are the most commonly reported symptoms associated with a meningioma brain tumor. So if you have any of these symptoms, there's a couple things I'd like for you to do. Okay, so here's what you're going to do. Have the fact that you've taken Depo Provera documented in your medical chart. If you're having any of those symptoms that we mentioned under the different symptom signs that there might be a meningioma brain tumor, have your provider alerted to that. So get an appointment, because that needs to be investigated. And if you do have a meningioma, there are safe and effective treatments to take care of it. I put out a lot of content, free recipes, resources, explanations for scary topics. I feel like when you know more about something, it makes it a little less scary and easier to take action. I'll talk with you in the next video.